Surgery or no surgery? That's the big question for today. What's the best thing to get me to the start line of Ironman Coeur d'Alene in less than 4 months? And is that the best thing for my long-term health? I'm Joe Klinedinst of JK Endurance Coaching, and this is my journey from knee surgery to Ironman in 115 days. February 10th, I had my MRI. The MRI itself, there was nothing to it, in and out, no problem. Probably the worst part of it was having to wait. I had the MRI, like I said, on the 10th. I wasn't able to get in to see Dr. Ulmer to find out my results until the following week on the 15th. And when I met with Dr. Ulmer, as he suspected, it was or is a torn meniscus. And, I have the results right here in front of me, and kind of highlight a couple things. So along with the torn meniscus, which he suspected, the medical terms, and again, little disclaimer, I am in no way a doctor. I am a video production teacher, is what I do, along with a triathlon coach. So I'm going to try to read some of this the best I can so you can relate to some of the injuries that I have with my knee. And again, with my goal being to get them recovered and get myself to the start line of that Ironman in about 4 months, as well as hopefully continue my endurance career well beyond that. So with that disclaimer, the meniscus itself is a non-displaced horizontal tear of the posterior horn contacting the inferior articular surface, okay? On a scale of 1 to 100, as far as tears, it seems to be not too extreme. From the reaction of my doctor and the procedure he's recommending. And this is on the medial meniscus, the lateral meniscus. The outside one is fine. ACL is fine, PCL is fine. MCL, it says it's intact with some thickening and suspicious low-grade sprain. The patella was good, a little bit of cartilage loss there, and that again could be where I had that previous surgery. This was the one that was unexpected, but it really went back to the extreme pain I was having when I tried to run through this injury, and that had to do with the bone. So it says a marrow edema. Bottom line was, there's a fracture line there, and he, rather than calling it a stress fracture, he said he thinks we called it at the point it was only a stress reaction. So the good news in that was it wasn't, completely devastating to the area. And I think again, going back, and I said about the MCL, so what the kind of my hypothesis is, when I had the meniscus tear and tried to just continue to run on it and do my workouts and do the intensity that I was trying to do and I had some pain, but it just seemed like something I'd be able to work through. Some alterations in my gait and my contact with the ground and how I was bearing my weight was causing strain to the MCL and causing that some bone on bone type of contact that resulted in a not a stress fracture, but a reaction that was close to being a fracture. So again, when I decided to take some breaks in there in my program from running altogether, was kind of the savior of maybe letting that start to heal a little bit. All right, ready to knock out the afternoon session. It'll be my last run before surgery. Just 45 minutes, easy, maybe a high 7s, 8-minute pace on the treadmill. It's kind of a base, kind of standard pace. I was trying to run through all this, and then when I got the stress reaction in my knee and the pain was just too much, I kind of weaned off after a few weeks of no running. Then I would hit maybe if I wanted a 45-minute run, I was knocking it out as 20 minutes elliptical, and then maybe 20 minutes here, or even days I did 10, 10, 10, 10, just to get my total of 45 or up to an hour. But everything's just, no workouts, just kind of standard basic pace. So after kind of working my way back up, I'm into the point now where I can do 45 straight minutes. Every so often I got to stop and kind of, let things crack and pop, and then I can go back to it. Doc said I shouldn't be doing any damage as long as that stress reaction doesn't flare back up. So again, just get a little bit of a run in, and hopefully a couple weeks from now, I'll be right back in here. I'm hoping to progress the same way after surgery, where I start with elliptical, start doing a little bit of both, to where I can get, wean off elliptical and be straight into just full force into the running. Get it cranking. The recommendation of my doctor, Dr. Almer, is to go in and do a meniscectomy to trim the torn meniscus. His point of view or his perspective is he knows I'm an endurance athlete, that I want to continue to race and train. So he wants to make it as minimally invasive as possible. So obviously leave as much of that cartilage in there for cushion and being able to continue to run and train in the future. So that was good. And he also understands my, not urgency, but he wants to get me back to the lifestyle that I want, and which obviously, like, wanting to compete in this Ironman in June. It'll be a arthroscopic procedure, and the date for that is set for March 4th. I walked out of the appointment after the results of the MRI having a surgery scheduled. It wasn't shocking to me because, I knew it was one of the options of things to do. I did discuss with him a little bit. This isn't like a degenerative. I thought maybe that's what was going on. I read some stuff about meniscus injuries that, I've been doing endurance sports for a while, a lot of marathons and Ironmans. Is it something just wear and tear? And it does not seem the nature of the injury. I just really don't know. It wasn't an event where I fell or anything or twisted. It just had to be, something that, caused the problem or caused it to tear, and it's not going to fix itself. Meniscus cannot heal, so they can try to sew them together, but where my tear is, that's not an option. So it's either let it how it is, and like his example was, I could have success, I could do some rehab and be feeling great, and maybe I get to be within a week out of my Ironman event or a marathon event, maybe a year and a half from now, things could be going great, and all of a sudden, boom, it could act up and get kind of, flipped around in a way that it's going to cause all kinds of pain again. So just to want to be able to kind of continue down the path of endurance sports, the best option seems to be to get that piece trimmed up and get me back, to where I want to be. So I left the appointment with surgery locked in for March 4th. I did continue to kind of second guess that decision. I continued to kind of do a little bit of research, weigh the pros and cons of surgery versus rehab. But it all kind of went back to what he said about the, like things could be going great, and then all of a sudden it could flare up again. Whereas the trimming, getting the procedure done, hopefully with proper rehab after the surgery, should make it a done deal, something I don't have to deal with. So basically for, what do I have? About 3 weeks until surgery, and the game plan in the next 3 weeks is to continue to hammer on the bike and the swim, because those I can do without a problem. Continue with just the easy and basic running, maybe 15 or so miles a week, just to keep some fitness there and try not to disturb things any worse. And the other thing I've added is I've started doing some of the, I call them prehab exercises. So I looked at the program of how I'm going to do some of the rehab physical therapy, and I'm starting to do those exercises ahead of time. I'm just going to take you through the prehab, I'm calling it, routine that I do, testing out those exercises and getting a good base sense of the strength in the leg. again, in my research, I'm finding like literally from day one after the surgery, it'll be weight bearing, and you're encouraged to get moving with range of motion exercises and some of like the activation of the quad, literally on the first day. And by the second day, you can even add more of the rehabilitation exercises in. Maybe even sit on the bike on that second day and just for range of motion, no power, but just try to get that range of motion, get all the swelling and fluids getting pushed out of that knee to get back to training as soon as possible. Something else that I've found is that this is probably the longest stretch of time where I've had a low volume run program since I've been a triathlete, and my biking is just really kind of making some huge gains. So it is 4:44 in the morning. 2 days, Tuesday, Wednesday, Thursday. 2 days pre-op for my meniscus surgery. And I'm just getting ready to hammer out a bike session, 9 by 4 minutes at hopefully about 330 watts. So knee is doing good on the bike, and that's what we're gonna do. We're gonna crank it today and see how much I lose after the surgery. One of the things going on with my knee is like during a warm-up on the bike, or when I start pushing the harder sets and the bigger gears, my kneecap feels like it's not tracking correctly. I kind of have to kind of push on it. Sometimes it'll pop, feel like it kind of slides into the right spot. Two to go. So 8 and 9 left. Power's up to 340. See if I can hang on for the last two. No knee problems really. Alright guys, main set is done. Just kind of supposed to be doing a easy cool down, but since I'll be off the bike for a little bit of time, at least, especially with the hard efforts, I'm just sitting in Ironman power around 250 watts, kind of the goal for the last like 15 minutes. Session is done. 9 by 4. Probably averaged like 335 throughout the set. Tried to start right about there. Hung on for a few. Tried to up it, but didn't have much more than that to give today. But it was at 36 good minutes. A little bit above FTP, so I'll take it. No, not much knee problem. If I had to go run right now, though, that would not pan out too well. So that's kind of how it's been for, I'd say, last 2 months. All right, so just a little bit of like a pre-surgery before and after. I'll look at the knee. Again, if you kind of take a look, there's no more swelling. I did have, initially when I had the injury, when I first was having troubles with my knee, I did have some little bit of like residual swelling around this area here above the kneecap. But now a pretty good range of motion. I can get pretty much the whole way back, a little bit of pain at the back of the range of motion, but straightening it, not much of a problem. This is just an old scar from burst the sac injury in college wrestling, so I don't think that has anything to do with the area. I've been having a lot of pain in this area here when I'm not running, like to touch, but then when I'm running, it seems to be a little more, in this area where the popping and stuff. And like when I was biking today, my kneecap seemed to like shift and pop around a little bit. So Thursday, 2 incisions here to go in and clean up that meniscus, and then hopefully be back to my old self. It's gonna be really interesting once I can get over and done with this procedure and start, getting myself back to that level of bike fitness and then reintroduce all of the running, what kind of a bump I might see in total fitness. So it's kind of one of those things where you take something that maybe seemed like a negative and having to deal with the injury and the lack of running, and spinning it around and kind of making it into a positive, because it is allowing me to see some gains in my bike fitness that just kind of go way beyond what I would normally see in this kind of part of the season. And like I said, also with the swimming, seeing some nice gains coming along there as well. So keep cranking on those workouts is kind of my game plan right up until the day of surgery. And the next time I'll see you back here will be on March 4th on surgery day.